Have you ever thought about how your body reacts aggressively when you smell the flowers in your garden? Or have you ever wondered why you had skin rashes after wearing your mom's jewelry when you were a kid? For today's episode, we will talk about a thing that affects a lot of us: hypersensitivity. Hypersensitivity, according to Stevens, is a heightened state of immune responsiveness. Typically, it is an exaggerated response to a harmless antigen that results in injury to the tissue, disease, or even death. So basically, there are four types of hypersensitivity: type 1, type 2, type 3, and type 4. Type 1 hypersensitivity. So this is characterized by a short time lag between antigen exposure and onset of symptoms that usually present within seconds or minutes. The allergens are known to trigger this type of reaction, and the patients that exhibits allergic hypersensitivity reactions produces a large amount of immunoglobulin E. Type 1 hypersensitivity reaction could also result to mast cell degranulation, releasing histamines and other inflammatory mediators. The mechanism of reaction is when antigen-allergens cross-link antibodies. This causes B cells to be activated, producing IgE antibodies. The antigen-antibody complex will synthesize the mast cells, leading to degranulation and release of the chemical mediators or the vasoactive substances like heparin and histamine. These mediators masking the antigens causes the signs and symptoms to appear. Hypersensitivity reactions include increase in vascular permeability, muscle contraction, and dilation of the blood vessels. This reaction causes the migration of the cells to the site of injury, and the overall manifestation of this reaction is inflammation. And these are the sample diseases with type 1 hypersensitivity. First is allergic rhinoconjunctivitis, which is a disease that's caused by the allergens that affects the nose and the eye at least once a week. The allergic rhinitis only affects the nose, and this is also called as the hay fever.